So I'm Dr. Subramaniyan. I am a junior consultant at Devadas Hospital, Madurai. Okay, so we'll just have a quick recap of what are the questions asked in this May INICET exam, and I'm not able to get much of the clear question from anywhere else, but I have tried my best. Okay, if any changes, do let me know. Okay, we'll go. What is this? Honda sign is seen, and this is a relatively new topic. So what is a scan? First, what is the scan? This is a bone scan. Okay, bone scan. Okay, so what does it show? Here there is a head-shaped lesion, right? This is known as Honda sign. Okay, this is seen in sacrum. For which condition? Sacral insufficiency. Is that okay? This is a relatively new question. Okay. Next. 17-year-old boy, increased pain and swelling in distal femur, sunburst appearance, Codman's triangle. Just a straightforward question. No need for any hiccups. Okay. Sunburst appearance, Codman's triangle, osteosarcoma. Okay. The deep branch of ulnar nerve supplies which muscle? Flexor pollicis longus, brevis, opponens digiti minimi, third lumbrical. Okay. These, except these muscle, all are supplied by this, and this. These three are supplied by median nerve. And this is supplied by deep branch of ulnar nerve. Is that okay? Yeah. Only step recommended by WHO to diagnose pot spine. I don't know if the question is correct, but I think this is the best I could get from you guys. So the best step, the only step that is recommended by WHO is CBNAT, also known as gene expert. Okay. Next question. 78-year female intertrochanteric fracture, management of choice. Okay. So Buck's traction. What is Buck's traction? This is a skin traction. Can be given for intertrochanteric fracture for a patient in a remote area where there is no access to any surgery or anything. Okay, so you could just give him. Apart from that, intramedullary femoral nail. This is used for shaft of femur fracture, the diaphyseal fracture, right? Yeah. Next, bipolar hemiarthroplasty. It is used for neck of femur fracture. Okay. For intertrochanteric fracture, it is always go for a proximal femoral nail. Okay. Unstable fracture. Okay. Okay. Suppose if they have given option as DHS, which one would you have gone? DHS or proximal femoral nail? Still, we have to go for a DHS. PFN. Okay, proximal femoral nail. DHS is a open procedure. What is DHS? Dynamic hip screw. Okay, whereas proximal femoral nail is a closed procedure. Closed procedure has got a better union, okay, than a open fracture. So this is a closed procedure. So you always go for a proximal femoral nail. Okay. This question, I am not sure, how did they ask some child diaphyseal shaft of femur fracture, 2 weeks old, presented with pain and fever. Which organism doesn't cause osteomyelitis? And this is the option that I could have got, but almost all the organism causes infection. You know that, right? But out of these option, the best option that we can go for this is strep. But there is an increased report for strep, okay, also causing, we have studies, okay, streptococcus are causing osteomyelitis. So this is, I'm not sure this is a exact question that they have asked in the exam, but let's see. Okay, if you have any anything to say, you just contact me. 45-year male, known case of rheumatoid arthritis, presents with myelopathy, cervical spine tenderness, most likely diagnosis. Okay, rheumatoid arthritis, the beauty of rheumatoid arthritis is it spares distal interphalangeal joint and the spine except C1 and C2. Okay, this is a thumb rule. Okay, rheumatoid arthritis doesn't affect the distal interphalangeal joints of the hand as well as the cervical spine, that too more precisely C1 and C2. Okay, so if they have asked this question, the most correct answer is atlantoaxial subluxation. Okay, yeah, 21-year male or female, I am not sure. Yeah, fall on outstretched hand, pain in anatomical snuff box, X-ray inconclusive. Next best step in management, what to do? What is the next best step? Yeah, always immobilize the fracture and repeat after. Some says MRI. Okay, no, MRI, it is for any stress fracture showing marrow edema. That too, MRI is done after 2 to 3 weeks. Okay, so the best option is immobilize in a thumb spica. Okay, and repeat X-ray after 10 to 14 days. Because, why 10 to 14 days? Because callus will be formed. If there is a fracture, the callus will be formed. Then we can plan for a treatment. Okay, so these 8 questions are asked in orthopedics in this May INICET. Okay, and thank you.